very much for your time. There's a quick poll that we have so we can kind of get an idea of our audience. And I want to really thank you. I appreciate your time today. We're very fortunate to have a village of folks working to make this possible. I'd like to especially thank Dr. Deborah Dyer with National Jewish Hospital, Morgan Mortazavi-Shan with the National Cancer Institute. They lead the Lung Cancer Task Force and work tirelessly to prevent lung cancer mortality. And also, of course, Chris Kelly with the State Health Department, the Colorado Department of Public Health and Environment. Her website, coloradoradon.info, has wonderful resources and information how to find low-cost test kits. So Chris can probably put that in the chat for us. And we have a special guest, Dr. Bill Field. He's an academic scholar and professor at the Department of Occupational and Environmental Health and Department of Epidemiology with the College of Public Health at the University of Iowa. He's a worldwide expert, internationally recognized on measurement and health effects of radon gas. The Iowa lung cancer study, which was overseen by Dr. Field, is considered the most comprehensive residential study ever performed. And he's a leading advocate around the world to reduce exposure in homes, schools, and workplaces. He's also actively involved with communication efforts to reduce smoking and radon-related lung cancer since the publication of the Iowa lung cancer study. And he's also launched meetings in 2009. He was the keynote address at the International Radon meetings for the World Health Organization and helped make that handbook on indoor radon. But to get started, let's start with a few local people. We have Terry Kerwin, who is the president of Rocky Mountain ARST. And if you're not familiar with ARST, it's the American Association of Radon Scientists and Technologists. And Heidi Nafman-Onda, a local advocate here in Colorado to help us share this information. So at that, I will turn it over to Terry.
Good afternoon, everyone. I'm excited to be here. I am the president of the Rocky Mountain chapter of the American Association of Scientists, Radon Scientists and Technologists, the Rocky Mountain chapter of ARST, we call it. I'm also the owner of Reliant Radon Solutions, which is a mitigation and testing company here in the Denver market. I am really happy to be here today to speak with you for a few minutes about why I do this and what we have going on here in Colorado. As most of you know, Colorado is a Zone 1 state where the average radon level in homes and buildings is over 6 picocuries per liter. Unfortunately, I'm in many homes of people every day, almost every day, who have never heard of radon or its dangers until either a real estate transaction or a lung cancer diagnosis for either themselves, their a family member, or someone they know, or a pet. I've had a lot of homes with pets with lung cancer. Why I decided to go into this business, I've been in business since 2015, and I did it for several reasons. The number one reason, I wanted to be in an industry where I could make a difference. I wanted more than just a job or just a profession. I wanted something where I could really get involved in and feel good about making good in the world. So after flipping 37 homes, and some were new construction, during the economic downturn here in Colorado between 2008 and 2015, I got a really big education in radon because I never hired the same radon company twice, but granted, none of the companies that I used were NRPP certified. So it's very important to hire a certified contractor, someone who's taken the training and made, makes a professional effort to get this job done right. And the other reason, one of the other reasons, after being told repeatedly by the real estate agents to air out the house before the monitor came to get set, I did some research and I found out not only is that problematic, but it can be harmful. This message seemed to come from a lack of understanding, not necessarily malice. And they thought the radon levels got higher the longer the monitor was set in the home when it was vacant and closed up. So, I would get, oh, it's been vacant for 3 months, so you need to air everything out or it's going to be super high compared to if it's only been closed up for 12 hours kind of thing. So that inspired me to really want to teach. I learned a lot about this. To educate people about the dangers it was very important to me. I lost a close friend to lung cancer, and everything just kind of added up to me being in this industry, and it just lined itself up. So more than 5 years later, my company has taught hundreds of realtors about radon in a 2-hour CE class that we provide. Our in-person classes obviously have transformed into Zoom classes during current times, but we're still out there teaching and reaching people with every class. We've taught and mentored both ASHI and InterNACHI home inspectors as well, continually during this time. Testing, in both testing according to the standards, as well as the red flags on an installed radon system. There was a very big lack of understanding in some of these trades also. We've opened many eyes in the real estate trade. Some lenders are now also requiring radon testing, regardless of whether the federal funds require it. In the 5 years time, our message is catching on, and our industry as a whole is making progress. There is a lot of printed information to share out there, including this pamphlet for real estate transaction, radon and real estate. So this is a printed copy. You can also download this from the Colorado website, and it also comes in Spanish, which is awesome. At www.coloradoradon.info, you can find this. And this is nice if you have if a real estate agent has a binder, you can print the whole thing and just put it in the binder for your client to take with all the other information that you're giving them. Or you can stick this in the pocket if you get the printed version. But it's important to definitely continue to educate. I serve as the president of our trade association, as I said earlier, and we helped draft a bill based on the Colorado Department of Regulatory Affairs audit that recommended that regulating our tradespeople by licensure through certification. So a bill title has been pulled, and we have by Colorado House of Representatives Kevin Van Winkle, and we are hopeful that it's going to be heard this legislative season or session. If this bill passes, the radon tradespeople will need to be trained and certified to hold a license in Colorado, much like other trades like plumbers and electricians. After this legislative push, we would love to see a Radon Awareness Act in Colorado, also to just further the education to our population. We need to get our message out there. I am one of the founding members of the Women Against Radon, a campaign for the nonprofit Cancer Survivors Against Radon. And I've recently joined the Colorado Cancer Coalition's Lung Task Force Subcommittee for Radon. There are so many ways to get involved, both nationally and locally, and share this important radon message. I've heard too many stories of harm due to radon, held many victims' hands while they've told me their stories, and hope that with education and awareness that we can shine some light on this issue and prevent this harm from happening. Wouldn't it be great if during our annual checkup at the doctor, after they asked us if we smoked, if they would ask us if we've tested our homes for radon. I'm very honored to be part of this fight and excited to hear Heidi's story and what Dr. Field has to share with us today also. Thank you.
Thank you, Terry. And Heidi, you're next.
Good afternoon, everyone. Thank you for letting me share my radon story with you. I'm a health educator and a fitness trainer, and my husband, Pierre, is a primary care physician. I'm also a lung cancer survivor and advocate. I've lived a very clean life. Again, we were both trained in prevention, and we were all blindsided by my stage 3A lung cancer diagnosis in October of 2018. It was an incidental finding while looking for another health issue, and I wasn't even having any symptoms, no respiratory symptoms at all. My treatment included chemo radiation, which entailed 30 radiation sessions and 3 cycles of chemo. And then I had a year of immunotherapy infusions, which ended in January of 2020. I just had a scan last week, 1 year out of treatment, and I am doing quite well. No evidence of disease. However, I live with the constant uncertainty of this could come back at any time. I had never heard anything about radon until I was diagnosed, and I didn't hear it from the American Lung Association or the American Cancer Society. I could find it on their websites, but I didn't hear it in a big way like I hear about smoking being the pretty much only cause of lung cancer, and therefore it wasn't on my radar or my husband's radar. I heard it from my son, who is an environmental engineer, and my kids were so shocked at my diagnosis because we've lived such a life of fitness and good nutrition. And my son asked me if I knew the radon level of my house. And I said, the what? I don't know what you're talking about. And he gave me a quick education, and we promptly had the house tested. Our level came back at a 7.8. And we had been in the house for over 20 years. We quickly got the house mitigated. It came down to a 1.6. So, it was something that wasn't, a huge expense or difficult to find someone to help us. And we got it down. To this day, though, I am still afraid to go in my basement. I never spent a whole lot of time in my basement. It was primarily my kids' playroom, and then it turned into a teenage hangout. So I'm actually quite concerned about them and their futures. Are they, at a high risk for lung cancer, or do they unknowingly have it now, as I unknowingly had it and at a late stage? I would hope that they could become eligible for screening. And then, as Terry said, after the smoking question, could you be asked, do you know the radon level of your house? Since this has been determined to be the second leading cause of lung cancer in people who smoke, and the first leading cause in people like myself who have never smoked. I really am concerned for them. I also want to share that after I was diagnosed, I had conversations with friends and family, and they were all shocked, but they said, radon wasn't an issue for them. They didn't need to worry about it because they already had mitigation, and it would be fine. And I said, well, my son mentioned that even with mitigation, you should check annually. A few of them did, and their radon levels actually turned out to be much higher than mine. They ranged anywhere from a 9.0 to a 22. And upon inspection by calling in mitigation services, they found that either their fan in the system wasn't working properly, or the system was just completely broken. So I'm very grateful for what listening to Terry and how they are pushing this, to increase awareness, because it really is needed. And
yeah, just briefly, I'll echo Terry's recommendation that primary care physicians should have a role in discussing the risks of radon with their parents. I think what they lack, though, is awareness. And I myself work in an organization that prides itself on preventive health as well as evidence-based medicine. And I think that's always been the pushback a little bit from physicians to sort of say, well, how do we quantify the risk? What's the latest evidence? The U.S. Preventative Services Task Force doesn't provide us much guidance on that. So I look forward to any efforts and Dr. Field's discussion about what would be the best way to improve the awareness that physicians have about the current risks and what to tell their patients.
Thank you.
Thank you, Dr. Field. You're up.
Okay, let's start the presentation here. It always starts when you give a presentation to start at the beginning. I found. So my talk is about what medical care providers and influencers need to know about radon gas. But what I wanted to do was just provide an overview of radon and talk about some of the resources available for physicians or other healthcare providers or other influencers. And I think a lot of the misinterpretation that we understand that a lot of physicians and healthcare providers misunderstand are misunderstandings the general public has too. So what I want to do over the next 30 minutes or so, this is my general overview. I want to talk about lung cancer mortality, radon occurrence, the health effects, radon epidemiology, radon testing and mitigation, and radon resources. So I think it's always good to look at how many deaths there are when you're talking about radon total in the United States. And these are the numbers that are the estimates for 2020. And you can see there's about 135,700 lung cancer estimated deaths that will occur in 2020. And what we're seeing with these is that it's probably the leading cause now for both men and women as far as cancer mortality in the United States. Breast cancer has a higher incidence, but a lower mortality, and prostate has a high incidence for males. But if you look at this, if you look at how big of a problem lung cancer is, if you look at the next three estimated mortality or deaths, it almost equals lung cancer and bronchitis. So lung cancer is just so high, it really dwarfs all the other lung cancer statistics as far as mortality, not to minimize those at all, because there's still major causes of cancer mortality. But it's just such a big problem. So radon it's a radioactive gas. It's naturally occurring outdoors, but it's not naturally occurring indoors. The way we build houses tends to trap radon. So while the EPA may not, I consider radon indoors to be a technologically enhanced radiation, because we build houses in such a way that traps radon. We don't have to build them this way. I mean, we don't build homes with lead paint anymore. So any efforts we can make to build homes radon resistant is really helpful. But radon's journey starts with uranium-238 that goes to radium-226, and these are the half-lives. So you see there's going to be an eternal source for radon in the soil under the homes. And it develops into radon is a radioactive gas. It's in the soil, and then that moves into the home through cracks around penetrations where pipes come through, or cracks in the foundation, sump wells, or a lot of different entry points. Now, I just want to so we're all talking the same measurements here. We're talking a lot in picocuries or picocuries, and that's 2.2 disintegrations per minute. And EPA's radon action level is not a standard, it's an action level. We'll talk a bit more about it. It's 4 picocuries per liter. World Health Organization reference levels below that. It's a 2.7. So this is the reference level that they set a few years ago. National indoor concentrations in the United States is about 1.3, and the national average outdoor radon concentrations is about 0.4. Although there's states like Iowa and Colorado that have much higher outdoor radon concentrations than these. If you look at the distribution of radon around the United States, you can see the areas through here and up through the Reading Prong have very high radon concentrations. And the red zone is zone 1, and these are counties in the United States that generally have above 4 picocuries per liter for that county. But that doesn't mean like you can go down these areas where there's lower radon concentrations, even in some of these areas where there's low radon predictive values, you can have very high radon concentrations. So a lot of people don't like the use of this map, because if you look at the states where it's high, if you then look at these states, it's sort of where not to test. So some people in some states have been dissuaded from testing because they have a lower risk. But as we know, for Colorado, all of Colorado is zone 1, which is the highest zone the EPA uses. So in Colorado, about half the homes have radon concentrations higher than the EPA's recommended action level at 4 picocuries per liter. Now, as I go through this, I'll be talking about the EPA's action level, but I want you to know it's not a health-based guideline. This is just a recommendation that at the time was formulated by EPA in regards to what was technologically available to mitigate homes before. So there's risk that occurs below 4 picocuries per liter. I think that's important to know as well. Now, radon can enter a home or other building in numerous ways. The primary way radon enters a home is from the source underneath the foundation of a home. So you don't have to have a basement, be slab on grade, but the radon will make its way up through the penetrations. If you have a crawl space, it will go in there, sump pumps or penetrations, as I discussed. A secondary source of radon that is an important source in some states is from use of groundwater that contains high concentrations of radon. And radon then, as it enters the home, if it's used for showering or through use of dishwasher, it will off-gas into the home. And in some rare occasions, you can have some emanation from building materials, but we don't see that as a major source in the United States. Now, what's really important, and this is one of the misperceptions that when we developed the Healthcare Providers Guide for Radon, and I did 10 or 20 different focus groups with healthcare providers. This is one of the biggest misunderstandings that healthcare providers have and influencers or members of the general public have. As radon decays, it decays into a series of radioactive decay products. These decay products are solid particles. And what's causing the damage is not to your lung, it's not the radon gas itself, it's these radioactive decay products. So if you could filter out all these radioactive decay products in your home and even have elevated radon concentrations, your risk will really go down, because these particles you breathe in as you walk around your home. If you've ever seen a light coming in a window and you see a dust particle floating, that one little dust particle, excuse me, may have 30 or 40 radon decay products attached to it. It's the ones with the smaller size that you breathe in and they get deposited deep in your lung on your bronchial epithelium that can cause the trouble. So here's the decay chain, and we have radon that's a gas with a 4-day half-life, so in 4 days, half of it's gone, but it decays to these solid little particles. So all these are solid particles. You can see varying half-life. Some are very short, but these are what you breathe in, these little solid decay products. And 2 of the decay products are particularly troublesome and cause the most of the dose when you breathe in, and that's polonium-218 and polonium-214. Now, these different symbols means this is what they decay from when they go underneath radioactive decay. So radon decays by alpha and gamma decay, and here's beta and gamma decay. But these 2 alpha emitting solid decay products are the ones that cause most of the dose. So cancer is considered monoclonal. In other words, cancer can start just with a defect in one cell. So you have this alpha particle coming off one of those solid decay particles that was deposited to the bronchial epithelium in your lung. And as they decay, these alpha particles are big particles, but they don't travel very far. But with your lung, the living surface of your lung is living tissue. They don't have to travel far, but where they travel through, they give off a lot of damage and then cause free radical formation. And the free radical formation can damage the DNA, initiate the lung cancer, or they can cause single and double strand DNA breaks. And radon's kind of unique in its ability to cause a high number or a high percent of double strand DNA breaks that sometimes it's very hard to repair and you get a defect. And we found that different genes can be affected by radon, like tumor suppressor genes. A study we reported on about 15 years ago, about half the people listening to this webinar are missing this specific gene, GSTM1. And what GSTM1 does, it helps provide antioxidants so that when you have this free radical formation, the antioxidants help counter it. If you don't have GSTM1, you have a much higher risk of developing lung cancer in general, as well as radon-induced lung cancer. So why I'm pointing this out is there's a lot of genes that work in this way. So we don't all have the same risk. Some of us, depending on our genetics, have greater risk to radon-induced lung cancer. I just want to give you an example of alpha particles. Something you can look at. So this is a typical long-term alpha tract radon detector. And this little piece of plastic, CR39 plastic, is inside this detector. And you put these in your home for generally 3 months to a year or so. And the radon goes in, undergoes further decay. And as it decays, the alpha particles hit this little piece of plastic. When this gets to the lab, you take this little piece of plastic and you etch it overnight, and then you count the number of tracks. And this is an example of what it looks like under 100 magnification. The plastic looks like all these little tracks are alpha particles. So when you think about an alpha particle hitting your lungs, your bronchial epithelium, think about what it's doing to this little piece of plastic. If it can put a little dent in this piece of plastic, it certainly can damage DNA. So it sort of gives you sort of a visual, the damage that alpha particles can cause. Now, how do we know about the health effects of radon? Well, many years ago, studies have been going on for hundreds of years of miners that worked in underground mines, developing various lung diseases. We know there's silica, we know there's carbon monoxide, lots of different factors, but they couldn't figure out with some mines why there's this extra increase in lung cancer. And they started looking. Back then they didn't know about radon. They thought there was this radon emanation that was radium emanation, they called it, that was coming out and causing these lung cancers. But following the beginning hypotheses that there may be this gas when radon was discovered, started doing studies of these miners. Now, these are all what's called cohort studies that have been done all over the world. And this is each one. And some of these studies can have 1,000 different participants. Now, these are mostly male miners that have worked underground in mines, have high radon exposure. And these findings from these studies were what EPA first used to come up with the risk estimates for radon. So this is just to show you some of these. These are called dose response curves. They're on this bottom x-axis. This is a cumulative measure of radon in working level months, and this is increased risk as you go up. So like if you go up to a 2, that's like 100% increased risk, and so on. So these are really significantly increased risk. The important thing to know, you don't need to know about the working level months, but if the red lines on these different studies, this would be what kind of exposures you would see if you lived in your home for 50, 60 years, as far as a comparison to what the miners received in their studies. So this is a home living in your home for 20 years. This is the kind of exposure you would receive. And you can see a lot of these miner studies, there's overlaps with what the miners were exposed to and what they did dose response for estimates and what you could see in your home. Now, some mines had very high exposure, so there's very little overlap. But this is the dose response for the different cohort studies. These cohort studies, they identify a cohort and then they look at their adverse health outcomes. What kind of diseases do they get? But you can see some of these. Ontario, there's a good bit of overlap with what you could be exposed to in your home. And this one, you can see there's excellent overlap. So they knew the risk was higher for higher exposures. So the National Academy of Science reviewed the risk estimates from the miner-based studies back in 1999. It's called the Beer 6 report, Biological Effects of Ionizing Radiation. And they estimated there's around 19,000 lung cancer deaths each year in the United States due to residential radon exposure. Now, these were based on extrapolations or interpolations, more precisely, from the miner data down to what a person would see in their home. And some of the concerns about these studies were that, well, they're mostly men. It's men working, so they're breathing faster. The depositions are different in a mine. You have silica, you have different concentrations of dust. You're breathing faster, you're doing more oral breathing. So how good are these estimates for the general population? There was concerns and questions about that. Well, the EPA realized that additional studies have been done, but they came out with this risk estimate. So they updated the National Academy of Science risk estimate using updated demographic information that was available in 1995. And this is the number you see today, the 21,000 lung cancer deaths. Now, if you would update this number, there's this synergism between radon and smoking. When I say synergism, you just don't have the risk from smoking and the risk from radon. When you put them together, you have more than just an additive risk, but it's not multiplicative. So if you have decreased smoking like we do now, we have less of that synergism out there. So this number would go down. So the number of deaths would go down. However, we have more people exposed now than we've ever had exposed. So 21,000, even though this was based on 1995 estimates, is probably a pretty good estimate even for today. So if you look at the EPA's estimate, this is a table. For never smokers, the risk estimates at 4 picocuries per liter is 7 in 1,000. And for smokers, it's 62 in 1,000. And you can see based on different concentrations, you have different projections. This comes from the EPA data that's been available since late 1990s or so. One of the important things to look at, 7 in 1,000. EPA regulates chemicals at 1 in 100,000 chance of causing cancer. So if we treated radon, if the EPA treated radon like the EPA treats other chemicals, we'd have to reduce radon, have an allowable exposure of not 0.4, which is the outdoor concentration, but 0.4. So we'd have to mitigate outdoor air if we had the same criteria for radon that we had for other environmental carcinogens that or other chemicals that the EPA regulates. So as you can see, this is a very substantial risk. So I get very often when I talk to healthcare providers, I get this, Bill, I don't see many people coming in our offices or something with lung cancer that never smoked. Well, the estimate is there's about 20,000 people that develop lung cancer every year that never smoked. So if you look at 135,000 overall and 20,000 that never smoked, no, you're not going to see many coming in the office that never smoked compared to the overall burden, which is due mainly to smoking. But if you look at that 21,000, how that compares to other sources of cancer mortality, it ranks in the top 10 of cancer mortality overall. So radon is one of the top 10 leading causes of cancer mortality in the United States, but you don't hear that very often. I've called it the leading environmental cause of cancer mortality in the United States. The other thing to take note in this whole number is there's about 20,000 people that never smoked that also get lung cancer every year. So lung cancer in never smokers is one of the top 10 causes of cancer mortality in the United States as well. So that just points out how big this number is, this 135,000 number, and even percentages of that have a big substantial impact on mortality. So because of these concerns I talked about with the minor-based studies, the problems with deposition environment, inhaling with your mouth, working out, all male, there's a real push to do residential radon case control studies around the world. And a case control study differs from a cohort study. You don't find a cohort, then follow and see what happens to the people. With a case control study, I'll give you an example of the one we performed in Iowa. We used Iowa as the sampling frame. So Iowa is where we did the study. So anyone that had an incident lung cancer, we would identify, ask them if they want to participate, and we'd be out there within 30 days of their cancer diagnosis, contact them, ask them if they'd like to be in the study. We measure the radon concentration in the home of the people with lung cancer, and then we would find controls that match to the cancer case. So we would match them by sex, and we match them by within 5 years of age. And then you look at if the people with lung cancer have higher radon concentrations than the people without lung cancer. And that's called an odds ratio. So it's the odds of being exposed for cases over the odds of being exposed for controls, and that's what gives you your risk estimates. So each of these studies reported their risk, and I think all but 2 of these studies had a positive finding. And the chance of having a positive finding is like less than 1 in 10,000 for the number of studies that did. So I mean, it's very, that information alone provided a lot of information, but we thought it'd be worthwhile to pool these studies. So we pooled the North American studies and the European studies. And you may have heard of meta-analysis. Meta-analysis is when you take, say, 4 or 5 studies and you look at the summary risk that the people have over time. You see some study may show 20% increased risk, another study may show 60, another one may show 40, and you sort of combine those risks. With a pooled analysis, we took all the individual data from each of the studies. So we had to take the lowest common denominator data from all the studies, pull it together as if it was one study and come up with risk estimates. So we did that for North American, and the Europeans also performed that. Sarah Darby from Oxford organized that. And we published a series of papers. These poolings were done in 2004, 2006. And our findings from these studies is that now this is the agreement, this is the risk estimates we obtained from the pooled analysis. So there was about a 10 to 18% increased risk at 3 picocuries per liter for the North American, and about a 16% for the European studies. So you see there's really good agreement with what we found for both the pooled analysis. Now remember, this is not at 4, this is at 3 picocuries per liter, which is below the EP's action level. If you put all this together, this is sort of a cumulative plot. So this is North American pooled analysis. 1 is no increased risk. 2 would be 100% increased risk. And this is this odds ratio I talked about, the odds of being exposed for a case over the odds of being exposed for the control. So as the concentrations increase for the North American studies, you can see there's an increase. So like I said, this is 100%, it's 2, but it's 100% increased risk. So you can see the risk increasing as the radon concentrations get higher. This is the Chinese pooled study. You can see their risk increase as the radon concentrations got higher. This is a finding for the minor studies. And you can see there's really good agreement between the projections for the minor studies versus what we found from directly looking at the case control studies. Now, you may hear a lot of criticisms that all those risk estimates are projections from minor studies, or they're all projections, using this or that. Well, yes, this is an interpolation from the minor-based study, but this is direct evidence from studies of people living in their homes. So it's not projections at all, but there's good agreement. And in epidemiology, when you look at causality, in other words, the one exposure caused a certain outcome, what you look for is agreement between studies. You look for a dose-response relationship, and these are the kind of factors you look for to say something caused something else. And here you can see this fits a lot of the criteria for causality. So just talk real briefly about radon testing within a room. Detectors are supposed to be placed up somewhere in the breathing zone. And here's the criteria: you want them away from walls, away from a window, a place where they won't be disturbed or the dog will eat them. And generally for EPA guidelines, you can take 2 simultaneous tests. If the average of both is greater than 4, mitigation is recommended. If it's not, no mitigation is recommended. Very often there's 1 test performed with a follow-up test. Homes with high radon can be remediated. A lot of you know this. There's active soil depressurization as a means of creating a vacuum. And some of these slides, a lot of you probably know Doug Clatter is out your way. I borrowed these from Doug. I used to put his name on them, but it's been so long, I'm hoping he forgets I'm still using them. So let's see. If you see Doug, tell him I'm still using some of his slides. So as you know, there's they do a communication test when the mitigator goes out, where they'll drill a hole through one side of the pad and then through the other side, and put a suction to one side and maybe generate smoke and see if that smoke's pulled down, see if it's good communication across the pad. Make sure there's not a footer there or something that's blocking it, that you would require 2 suction points. It's usually 3 or 4 inch PVC. Has to go up out above the eaves. The fan's put up here. You don't want the fan down here and then have a leak here with the radon going into the house. Used to be, when the fans were first put in, they were put in here where there was a window open above them, the radon would go back in. And you have a home too sometimes with crawl spaces, and that has to be sealed. But you can, the systems nowadays do an excellent job, as the folks working in mitigation can tell you. Those homes can be mitigated to below 2. This is sort of what it looks like going through the slab. With a pit dug out down below here. Sometimes these are put in sump pumps that already have a drainage tile that it can pull into, and then pipes routed to the fan. This is what it looks like up above. So I have here 11-year expected life. My first one lasted 20 years, so I guess I was fortunate. And that's what it looks like outside the exterior of the house. Then homes can also be built radon resistant. So when the home's built, you have gravel down here, 4 inches of gravel or so, and you can put the pipes in or in the crawl space and seal it above with plastic. And then you can put your system in, and generally they don't put a fan in. This is capped, and then when the homeowner moves in, so it's like radon ready, radon resistant. They can do a test, and if the radon is above 4, then rather than to have to go back and do put the whole system in the pipes there, all you have to do is hook up a fan. One of the problems that we're having with these is you have radon resistant homes, and a homeowner will move in and they will see they have a mitigation system put in there already, but they don't know there's not a fan. They don't do any testing to check how good the system's working. But these work very well, and it's probably the best cost-effective measure. A lot of municipalities now have requirements for radon-resistant new construction for new homes. This is on the Colorado website, and I think Terry's already lifted this up. It's the radon real estate transactions in Colorado, and this is really a nice guideline, a nice booklet. A lot of states don't have something like this, so a lot of times people are really confused during real estate transactions. So I really applaud them for having a document like this that can be downloaded, or there's paper copies available. It's an excellent document. And within there, it talks about the real estate transaction requirements, how there's radon disclosures required. So if you're selling a home and you've done testing before, you have to provide that information to the buyer, even if the concentrations were less than 4 picocuries per liter. But you should provide copies of reports, or let them know what disclose what the radon concentrations were. And there's one of the forms that you commonly see within the residential disclosure for a property. And I just want to mention here that one of the few benefits or few helps that the government provides for radon nationally is that this is a covered expense under a lot of federal spending accounts. So if you have a federal spending account, the cost for mitigation is something that you can use your healthcare spending account for. I just want to talk a little bit about resources. I can give a whole presentation just on information that's available for healthcare providers, but we have this site at the Iowa Cancer Center that we worked and developed with the Iowa Cancer Consortium and with EPA and the Council of Radiation Control Program Directors that have just been tremendously helpful, helping us generate information for providers. And we have a couple of videos there that have the perspective, sort of gave us some of the perspective that Heidi so graciously provided just a bit ago about how it affects you personally and what your experiences are. It also talks about from the perspective of a healthcare provider. I mean, it was one of the patients that we highlighted in this video was a patient that educated her doctor about it, and he went and tested. So it shouldn't be that way. It should be the healthcare providers helping to educate the patient about it. But in this case, it was the reverse. So I urge you to look at this, and we have different flyers that can be downloaded and used. And the other thing, it was through the funding of Council of Radiation Control Programs Directors allowed us to develop this guideline for healthcare providers. The previous one, if a healthcare provider would go and look, it was 20 years old, really outdated. So we worked with them to develop this new guide for healthcare providers. And I urge you to go to the website. That's Breathing Easier. If you just search radon healthcare providers, it will pop up. And it's a really good resource. It has a lot of studies. And also, if you go to the Iowa website, Breathing Easier, all I have to put in really is http breathingeasier.info. It will have this guide as well, plus all the scientific publications in PDF form that help support the information in the guide. Some of the interventions that we have in the guide was just asking them if they've tested for radon. So few do that, and since the guide's out now, I'm getting a lot more communication with providers that are asking just how to phrase the question. Add radon testing to the electronic medical record. Team up with CDC funded comprehensive control program and the cancer consortiums or coalitions within the state. These folks have a heart for dealing with all kinds of different types of cancer. And many of them, as we heard today, are involved as well with radon. And that's a great place to donate your time and be involved with helping educate the people within the state. But these are some of these other sources for Iowa, and this would be state specific. United States Public Health Task Force also recommends LCD screening for people with a certain amount of smoking history. So if they're 55 to 80 who smoked 30 pack years and haven't smoked within the smoke or have quit within the last 15 years are eligible for the screening. And as soon as this came out, they do mention radon as well. I was questioned by the task force. They said, well, what's the equivalent for radon as far as tobacco or number of cigarettes? And that's something that's going to have to be decided by some sort of agreement, consensus. So I think that's something they may work on in the future. I've been trying to urge them to do that. But I think if you're very close to this and you have documented history of radon exposure, I know a lot of cancer screening centers that are allowing that as a factor in considering whether or not someone's eligible. And then just share information about exposure. Encourage them to participate in discussion forums that we have at Radon Leaders. And I think one of the best things they can do is for the healthcare providers to test themselves, so they have that experience. In many cases, they have elevated concentration, so they go through the process of radon mitigation. And if you look at who tests most, it's radon. It's the healthcare providers that test. They're one of the biggest groups of highest percentage of people testing. So it would be good to lead by example. And this is what we're trying, this is just a simplistic example, but this is what we're trying to get added to electronic medical records. Have you tested your home for radon? And the guide is available, as I said, here, or just searching radon healthcare providers. It will pop up in a Google search. These are the videos that I talked about. I really urge you to read these. It was narrated by Chuck Lynch, who is the medical director of the Iowa Cancer Registry. And we're trying to get a lot of publications out for the healthcare providers. I'm working with groups that help educate young physicians and nursing and other allied health professionals. We're almost done with a CME on radon and be certified credit for nurses as well. But we're trying to get articles out here. This was something that was in 2008 issue of American Family Physician that we got a lot of positive feedback on. So for additional information that's state specific, please contact Christine. She's one of the best radon coordinators, if not the best radon coordinator in the country. Just very active, wonderful resource. And please feel free. So anyone on the call today, please feel free to contact me directly. I gave you a lot of information, and I view these webinars as a place for us just to meet and discuss radon a little bit. If it's not now or in the future, you'll have a question, and I just urge you to contact me if I can be of any assistance in the future. So thank you for the invitation again. It was great to be here with you.
All right, thank you, Dr. Field. We can open it up to questions. I think one that we have right off the bat is, are your slides available to folks that want to use them? And what else was in that question?
Yes, please contact me directly, and I'll share my slides, and I'll share Doug's slides as well.
Okay, Tony, reach out to Dr. Field, and I can help you if you need any help as well. Thank you for asking that question.
Yep, happy to share them. That'd be great if you could take what you need, and if you're giving any presentations to use for your presentations, let them get used as much as possible.
That was the other part of Tony's question, was if he could have permission to use your pictures and graphics.
Yep.
We all like to share in the radon industry. There's no sense in recreating the wheel.
That's right. So my email and okay, I ended it. If you just search Bill, just put in Bill-Field, just Bill-Field at uiowa.edu. Or if you just go on Google and put the field and radon, especially if you put Iowa, I'll pop up in a lot of contact. People find me, but Bill-Field at uiowa.edu. There it is. And please contact me.
I can speak to that. Dr. Field is very accessible and has been just an amazing resource to us over the years. So we appreciate all your work and your expertise. Thank you, thank you. Also, I'm going to just make a little announcement about the radon-resistant new construction that can be adopted into the homes. It's adopted into the building code. Part of the problem we have here in Colorado, we don't have a statewide building code, so it needs to be adopted jurisdiction by jurisdiction. And we have a growing number of cities and communities that are adopting it. The city and county of Denver just recently has adopted it into their building code, which is great because they're the most populated county that exists in Colorado. But it's important that it happen everywhere, even in some of the remote areas. And we're hoping local public health agencies can help educate the building officials about this, because it's taken care of. And it makes it easier for folks to install a fan and reduce their radon levels.
So Patty, it's Chris Kelly. I just noticed I've been working in the chat box trying to answer folks' questions. And we also had a couple pop up in the Q&A box. So I'm gonna bring those up. And the last question we have in the chat box is probably for Terry Kerwin. And it says, will the bill for this session require building codes to be updated statewide?
The answer to that would be no. We're not addressing building codes. We're simply requiring a license for our contractors via certification. So they will have to get trained. They'll have to continue their education and show proof of that. And they'll have to be certified by a recognized certification program like the NRPP or the NRSB. Each the building codes are completely separate. And that has to be handled, like Patty just said, jurisdiction to jurisdiction.
Okay, and our next question is from a building official in Longmont. And he said, we have adopted the radon passive requirements from the IRC. It's really hit and miss for other cities. And Blas is right. Like I said, we have the list of, if anybody's interested, if you go to coloradoradon.info, that's the state health department's radon page, and click on radon and real estate, we have the list of all the cities and counties that currently require radon systems in new homes. And good job, Longmont. You're helping protect the health of your citizens and anyone who moves into a new home in the future. So that's awesome. And Bruce Stanley said, Appendix F of the IRC explains all code requirements for radon. All the municipality needs to do is include this appendix in their code adoption. And it truly is that simple. When a city or a county adopts a new version of the building code or the International Residential Code, they have the choice which appendices they want to adopt. So those that choose to adopt Appendix F are ensuring that the homes are safe from radon gas in the future that are built in their municipality. And Eric Fried also said there's no statewide building code in Colorado, which he is totally correct. That's why we have to do this at the municipality level. And then for the two questions in the Q&A box, Alice asked, do radon tests and or the brochure show where to place the radon detectors? Or can Dr. Fields show that slide again? I could tell you that our real estate brochure does show that. Yeah. I believe so. Patty, tell me if I'm incorrect. And when you order a radon test kit, you do get instructions that come with it that contain that information. So that should be helpful to you.
Yeah, and help guide you to is generally, at the worst case, if you have a basement, you generally look at the worst case in the basement. You don't want them in any place where there's a lot of moisture, such as bathrooms or kitchens, but really think about where you spend time and sort of weight where you place it by where you spend time. That'll reflect your exposure.
Yeah, we like to say the lowest livable area of the home, quote unquote. You don't put it in a crawl space. You don't put it in a garage or a storage room that you never use. You want to know what your family is breathing in. So you put it in the lowest area of the house where you actually spend time.
Yep.
And then Jamie is apparently a Hawkeyes fan, Bill.
We need all we can get.
We got to go Hawkeyes.
All right.
And then Jamie asks, other than asking about radon testing, are there related questions that you would recommend PCPs integrate into routine practice? And that would be primary care physicians, I assume. So that would be a question for you, Bill.
Yeah, so if you go look at the guide, we have a series of recommendations, but I think the really important one is to ask if they've tested for radon, and if not, be able to provide the resources. So we even had some offices, they have a little prescription blank. It's already filled out with the 1-800-SOS radon, or it's like a prescription for radon. So the doctor will just sign the bottom, and they can take it and just remember different resources to get radon detectors. But the electronic one, I think, is really important. And a lot of times they don't see the physician. A lot of the questions are asked by the support staff. So just trying to get that integrated into the electronic medical record. And we've been successful. And I'd say 8 or 9, 10 big university hospitals so far, and some other hospitals. So I'm optimistic.
And I would also encourage physicians. I mean, I'm not just speaking for Colorado here because I'm the Colorado person, but a lot of us who run state radon programs in the United States, we are more than happy to provide physicians with free test kits and informational brochures for their patients. You're helping us helping us educate the public also. So I would say if you're ever in need or want of those kinds of things, talk to your local or state health department, and I'm sure any of us would be happy to provide the materials that you need to educate your patients about radon.
And I saw there's a question about the minimal exposure for radon. So there is no threshold. So as I mentioned, 1 cell is where the cancer initiates from. If you're just that unlucky person, to go to a building or live in a home that has even low radon concentrations, and that affects your 1 cell, it's just the chance is less. So there is no threshold for it. The other thing we know is that the minimum latency period is 5 years. So from the time you're exposed where that initiation occurs of the cancer, you're not going to see it manifest for 5 years. So I get a lot of calls. I moved into this new apartment, I developed lung cancer, and I asked them how long they've lived there, and they've lived there for 2 years. Well, that's probably 2% chance it was related to that radon exposure. It has to be 5 years out and further to be related to that lung cancer that was been developed. But there is no threshold. 2/3 of the radon-induced lung cancers occur below the EPA's action level. Only 1/3 occur above the EPA's action level. So 2/3 occur at these exposures less than 4 picocuries per liter, and that's why we're trying to, even though it's below 4, if you can get it down lower, that's all the better. EPA says that in their guidance as well.
Yeah, Dr. Field is totally correct. I mean, there is risk at any level, and one thing I like to tell citizens, Dr. Field, is that most of us don't even know what the levels of radon were in the houses we grew up in.
That's right.
So the best thing you can do for prevention to protect you and your family is to test your home, and if it's elevated, mitigate that risk with a radon mitigation system. Can't change what's happened in the past.
And I think the other point is, a lot of people think, well, there's a cost involved. There's a good chance if you are going to sell your house 10, 15 years from now, you'll have to mitigate it then. So why not mitigate it now? And then you take some advantage of the money you spent for some protection for yourself, since you may have to do it anyway when you sell it.
Excellent point. So a couple more questions rolling in. We're rubbing up on 1 o'clock here. So Bill, I'll let you answer this one. The long-term tests take many months. Is it okay to wait that long if you already know your levels are high? Or what is the long-term test recommended?
Yeah, so there's a lot of variation with radon, day to day, night times generally higher. So there's a lot of variation with the short-term tests. So what you really want to get is, what's your estimate of long-term exposure? So if you're in a situation where you think there may be some up and down with the radon concentration, it's good to go longer. But if you have some idea that the concentrations could be high or some reason to think so, yeah, I wouldn't wait for a long-term test, but you may want to do the short-term test and then confirm it with a longer-term test. I think that's an excellent question. Or if you're going to worry over that 3 months about it being high, then do short-term tests. Don't worry about, I wonder what that's going to be, and be concerned about it, because the concern and stress from a lot of these factors can be disadvantaged too as far as adverse health outcomes.
Yeah, and we usually recommend if folks do a short-term test and it's above 8, that you really consider mitigation.
Yeah.
If anything, just retest with another short-term and verify that. And then usually a long-term test is really recommended when your levels are kind of borderline, bouncing around 4. So then another question I've got is, and I'll try to take a couple of these on real quick, are there reliable radon detectors that can detect radon on a real-time basis? I posted this a little bit earlier in the chat if anybody wants to scan up. Some of those electronic devices are not actually approved devices that you see on the internet. And we recommend the public only use devices that are approved by the National Radon Proficiency Program. And you can get to their website at nrpp.info. Aspen would be happy to help get test kits to patients. Oh, that's Jeanette. She works with the Aspen Health Department. And yeah, Jeanette, they do a lot of outreach with their local hospitals too. So if there's any physicians here from the Aspen area, Jeanette Whitcomb is the way to go. She's awesome. Brendan Doyle, who is our Denver Department of Public Health and Environment person, has kits also to provide to medical providers. So if any of you from the Denver metro area, you can talk to Brendan. And if you aren't catching these people's names, I know who they are, so send me an email and I'll connect you. And then I was told that in a large basement, you may need 2 mitigation systems. Does that make sense?
Yeah.
Yeah.
Go ahead, I'm sorry.
Oh, that's okay. Sometimes, I think Dr. Field actually addressed this in his presentation, that sometimes you might have barriers underneath the slab that kind of separate it into 2 separate locations. And there may be a need for 2 mitigation systems, or sometimes you could put through 2 pipes that run to 1 fan on opposite ends. That's why you want to make sure you only use a certified contractor who knows what they're doing. They will do those tests like Dr. Fields talked about to determine exactly what kind of mitigation system you need.
And can I just thank Heidi and her husband? I mean, it takes tremendous, courage, I think, sometimes to go out and advocate for this. And there's nothing that's more influential than survivors that have been through this. So Heidi, I forget your husband's name, but thank you so much for doing this and sharing your experiences. Putting a face to this whole issue, I think is critically important to get people motivated to take action, and hearing your story. So thank you so much for sharing your experiences.
And
this is Debbie Dyer. I want to second that and say thanks certainly to Heidi and Pierre, and to Dr. Fields, and to Patty and our subcommittee of our lung cancer task force, the Radon subcommittee, who organized this. I'm the past chair of the Cancer Coalition and a co-chair of the Lung Cancer Task Force in Colorado. And I just thank you, Bill. I thank everybody who contributed today. This was very informative. I hope that we can, continue on and share this information beyond today, certainly.
Thank you, Debbie. We couldn't have done this without you. And please consider joining the Lung Cancer Task Force. They are just really working to reduce lung cancer mortality, and we couldn't do this without you. So thank you, thank you.
Bye-bye.